My name is Judah. I am 59 years old with B6 responsive classical homocystinuria. I was diagnosed in 1972 in Israel at the age of 7 after a fall from a plastic blow up chair. I did not respond like a normal child, which would have been to simply get up. My parents took me to the hospital to be evaluated, and it was discovered that I had HCU. I was I had I have had intensive HCU treatments throughout my life. In the fall of 1972, I was sent to the US to see a specialist. He confirmed that indeed I had classical homocystinuria. I was put on special low protein diet during my stay. In addition, I was put on vitamin B6. The diet was very strict in the hospital. It was extremely difficult as a young child to ascribe to such a diet. Many times I did not care for the food and did not eat it. When I went back to Israel, I was still on a low protein diet, but I had other things to choose from. As an adult, I expanded my options by experimenting with cooking things that I liked and that had little to no protein. Over many years, I have been able to adjust to more vegetarian diet that mirrors a protein base. Still very hard, but more tolerable. The amount of protein is very limited. I count my proteins every meal, so I do not go over my allotment. After I returned to Israel, my hair went from blonde to black, as seen by my pictures. My motor coordination drastically improved, and I was able to ride a gear bike. I always had struggles. I had to work harder than my peers to accomplish my schoolwork and college courses. I graduated from college. During my last year of college, I developed severe back pain. This resulted in several months at home, was treated with exercises, swimming, heating pads, and relaxing. These days, I still have back pains with flare ups. These days, I am on vitamin B6, B12, folic acid, and cysteine, as well as a low protein diet. My protein allowance is enough, so I don't need medical formula. The current options for HCU patients simply do not work well for me. Cysteine, which I take twice a day, is the only real option to combat high protein. I need to mask it with either applesauce or pudding. Current treatments cause stomach upset and are unpleasant to taste and smell. This does not encourage me to want to take it. I wish there were better options or better alternatives for me. In addition to HCU, I have many diseases that overlap with each other, such as diabetes and rheumatoid arthritis. All have their diet restrictions, which makes eating even more complicated. It is important to look at all these complications when addressing alternative options for HCU patients. This makes things extremely difficult for me to balance with various diet restrictions. I struggle daily to balance all these issues. I take a huge amount of insulin every day with monitoring 24/7, 365. I take orals and shots for RA. I would love to be treated with one process for all my medical issues. As I get older, I find very little knowledge of what my future might look like. We need to better understand older adults living with HCU and find better options for them. As far as trials, my whole life of over 5 decades has been a trial. Over the years, and with great difficulties, I have found a balance on my own that has stabilized my medical conditions. My doctors are always amazed. At this time, I would not risk losing this balance. I cannot risk or jeopardize my health for new clinical trials. Therefore, I would not participate in them. My hope for the future is that there are better options, such as pills, shots, or perhaps an inhaler, for people like myself who live with HCU as well as the next generation to come.